It's May 11th. We're here with Dr. Teresa Frankovich for her media availability. We're just going to jump right in. I'm going to start with a question that the reporter included a little bit of context, so I'll read that to you first and then we'll ask the question. Humboldt County has ramped up testing considerably this month, but it is still averaging, according to the reporter, 100 tests per day, according to the results released publicly, while the state has indicated it wants to see an average of 200 people tested daily. What's the biggest barrier to getting to that average locally, and can you predict when Humboldt County might achieve that goal?
So a couple things. What we are distinguishing between is our testing volume and our testing capacity. So we certainly, when you look at our testing volume, how many we're actually doing per day, I think actually the number provided is not quite correct. We certainly know, for instance, when we look at our Optum site testing, and I pulled a week of data here for a different report, and we've been testing more than 100 individuals per day in that site. Of course, that site operates 5 days a week. So when we average over the week, totals like 121, 116, 120, etc., actually ratchet down to an average. And I would say that our average overall for the week period I looked at was about 83 through that site. I do want to point out that that was the second week we were in operation, and we did have some capacity on those days. So I think we did great at getting more than 100 people in every day, but we want to aim for that 132 that they can accommodate. So I think we'll get there, particularly when we start to see more cases and there's more community interest in that. And when the process for getting yourself scheduled is really operating smoothly all of the time. Our internal lab, the numbers vary. There are days where we have all of our specimens lined up from a large screening the day before, and on a weekend day when it's otherwise quiet, we can run over 100 specimens. But on other days where the specimens come in over the course of the day, we're not able to be as efficient with that, and so our totals are less than that for sure. So we aim to have an internal capacity of about 60 per day on regular days, recognizing that there are days that we'll be able to exceed that and some days that they'll be lower, just depending how the specimens come in. But our capacity at this time is, I believe, well over 200. And so I think we do meet the criteria, and I think it will provide us with enough flexibility to test as we go forward.
Great. And there's a lot of speculation regarding the lack of continuous testing, which results in a lower tabulation of positive tests. What words can you offer to assure the public that there is a proper amount of testing?
Mm-hmm. Well, again, it's a work in progress, and our Optum test site over the last couple of weeks has really expanded that ability for us to do the testing across the sectors that we're interested in. High-risk individuals, people who just would like to be screened, and mildly symptomatic people, so that we're able to identify cases that might otherwise not come to medical attention. So actually, I think we're in really good shape. I mean, the couple of things that I would love to see happen, I would love to see us be able to get the cartridges for our Gene Expert machine, because that easily gives us 80 tests per day. And with the little extra piece of equipment we've ordered but have not yet received, we could make that 160. So that would hugely amplify our ability. And so we're in queue and hopeful, but we just don't have it on site yet. The other thing is that Optum has indicated from the start that we have the potential to expand their testing as well. And so when we can consistently meet those numbers for testing, we will be looking for that ability to expand those numbers to double essentially what we can. And then it's important for people to remember that we do have the commercial labs as a backup as well. So providers do send those. Those numbers are a little harder for us to access in real time, but that's a huge availability for testing right now as well.
Sure. And are those numbers underreported? We had discussed a little bit about that with the commercial labs.
Well, the large commercial labs, they're required to report the testing into our surveillance system. That's how we're able to see it. But we are quite aware that there is a lag time in that data getting entered. Fortunately, even though our Optum specimens are run through a commercial lab, through Optum we get access to those results before they enter into CalReady. So that system seems to be working really well and gives us more timely information. But absolutely, the commercial labs, as well as the point of care tests that are available in some offices locally, as well as some hospitals, those tests again should get reported in, but because they're a point of care test like the flu test you get, I think those are sometimes not getting reported in fully.
Okay. And speaking of the Optum site, last week you mentioned that public health doesn't have access to testing numbers or how many appointments are scheduled through Optum or at Redwood Acres. Is there a timeline of when that data will be available to you and released to the public?
Sure. So we recognized that problem when we shifted to the online platform, that we sort of lost control of the scheduling ourselves and having access to those numbers easily. We did make a request to Optum, and they have been helping us out by providing us with a list of people screened daily, so that we're able to follow those numbers, and that's how I was able to reference some of those testing numbers that I just gave you. So that piece is now up and running and giving us some better data, and when we've sort of got that system set so we're able to report it in a daily basis, we will in an easy way, but otherwise I would anticipate us being able to do that at least on a regular basis, perhaps weekly.
And are community members without symptoms getting tested at this time?
Absolutely, as well as our frontline higher risk individuals. General community members are able to schedule, and my understanding is the schedule is looking pretty packed this week, so that's good news.
And there were some county employees who tested positive for COVID-19. Are they being retested prior to returning to work?
Well, what I would explain to people is that that's not typically the way that we do this. So if you have a positive case of COVID, if you're a confirmed case, we use a test-based or a non-test-based clearing strategy. It's called symptom-based strategy. So currently the recommendations are for that you have no fever for 3 days at least without fever medicine, that your symptoms are improving, and we actually have expanded that to that you're 10 days out from the onset of symptoms. Those factors essentially remove you from isolation and allow you to return to your workplace. That being said, in some work settings, there are some differences in what employers want to see. For instance, in healthcare, sometimes they use something a little bit different in terms of what they require for clearance. But in general, what's endorsed by the state for most settings, as well as our local public health and CDC, is the ability to use symptom-based clearance. And in fact, the CDC no longer even states a preference for lab-based clearance.
Okay. How many positive cases of COVID-19 have been confirmed at the community testing site?
I believe one case.
Regarding the public information updates on positive cases locally, can you tell us anything at all in a general sense about the therapies or treatments for local patients, and if a ventilator has been used for treatment, etc.?
Again, we don't comment on the specifics for patients, but again, I'd point out that we have, at this time, have had no deaths related to COVID from our hospitalized patients, certainly, and we're not aware of any others at this time. So that's good news for all of us.
In May, the Humboldt County Public Health Lab has reported it has supplies on hand to process an average of over 1,200 additional tests. How do you balance the desire to test immediately with the need to keep an inventory on hand in the event of a surge? And what's the minimum supply you're comfortable with at any given time moving forward into phase 2?
Well, it's a good question. At the beginning, we really had two issues. One is just getting the darn supplies so that we could run our tests. And the second issue is just the size of our lab and the feasibility of actually how many tests can you run in a day. And again, we spoke to that in a previous question, but just that thing of as we're testing as specimens come in, it takes a certain amount of time just to process those, get them ready for a run and put them through. So it's just tougher to run a high volume lab that way, and public health labs in general are not set up for that. So what I would tell you is we currently have the reagents to do our testing, which is great. Our limiting factor is really sort of the internal capacity of the lab and processing. We put in an amazing amount of testing for a lab our size, but it's tiny. And these guys are working long weeks to accomplish the testing that they're doing. So what would make me happy is for us to be able to use some alternative strategies like our Gene Expert, because it requires a lot less staff time, particularly microbiology time, and would help us improve those numbers, but we just don't have it in hand yet. So we're not, basically, I'm sorry, to the point of the question too, we're not holding on to these supplies. It's really a matter of making sure that we have capacity in our lab on a daily basis to react to cases. So if we end up with somebody hospitalized, if we have an outbreak, those types of things, we want to make sure that we can get those cases in. But typically on a day-to-day basis right now, our limiting factor has really just been the way the specimens come in and then the processing.
So inventory is not really an issue
for that
anymore?
particular test. And that's the principal test that we're using at this time.
Have you seen the demand for testing go up or down following the reopening of some businesses? There's a part 2 to that too.
Well, we just really did that. That was Friday, right? So I haven't seen anything haven't had time to really see a trend in what we'll be witnessing in terms of people's interest in testing. Certainly as we go forward and we begin to do, for instance, foot traffic in retail establishments and such, it may all change.
Sure. And the part 2 of that was, are you seeing more people inquiring about testing than before?
Well, again, I certainly think we're seeing, my understanding is our schedule's looking very full this week already, and we're just on Monday. So I think that's a good sign that people are interested and willing to be tested.
Yeah. What has the county learned as surveillance testing has broadened?
So it's been really interesting. Again, we spoke to this, well over 600 tests have been done in the Optum test site. I don't have the exact number to date, but in spite of that fact, we've, I believe, identified 1 positive. So it's really helping us to understand, number one, virus circulating within our high-risk workforce, and it's been reassuring to see that, that number being low to none, and also just to get an idea of what's circulating out in our community. We know it's out there. We have evidence of that when we see emerging community transmission cases, but it's helpful to know that we don't seem to be having high levels of that circulating, and this will be a great indicator as we move forward through opening up our local economy and seeing in real time whether we're noting a real change in that trend.
How soon will the antibody testing be available in our area, and specifically in Hoover or Willow Creek?
Well, there are some entities, some of the commercial labs are offering serology testing, so providers do have that option of ordering testing for serology. There are some outpatient settings that offer that access as well. I do just want to remind people about this. From a public health standpoint, we're really excited about serology or antibody testing, because it's a really good tool for us to be able to kind of use at a population level to get an idea about how much exposure people may have had to the virus over time. But it's important for people to remember that the test itself, because we don't really know what a positive antibody test means. We don't know whether it is actually giving you protection against the virus if you encounter it again, and we don't know that if it does provide protection, how long that protection will last. And so there is no recommendation right now to use that test result to say, I'm completely in the clear and I can basically do anything because I'm not going to get sick. We really don't know that that's the case. And so, for instance, we don't divert healthcare workers into a position of risk just because of a positive test at this time. Down the road, we'll understand that a whole lot better, but right now it's really more of a public health tool than a personal health tool.
What is the accuracy of the tests used locally for COVID-19, and how will the accuracy be impacted when the county uses less invasive tests?
Mm-hmm. So the test that's used in our lab is a very highly specific lab and highly sensitive lab, and it's called a PCR test, and we can detect minute numbers of copies of the virus in someone. So it's very, very sensitive. When we look at, and the labs that are done at the commercial level are also PCR testing and are also excellent. You're right, down the road as we change, some of our point of care tests, for instance, are really good at picking up a positive case in someone who has symptoms. They're not as good at picking up virus that may be at very low levels in someone who has no symptoms. And so it's really not meant to be used for that purpose. So with every test that comes along, we look at that and the sensitivity and specificity of that in the sense of, does it tell us what we really need to know? And so we're just constantly evaluating those. You can go to the FDA's website and they list all of the FDA approved testing, but they are going back and revising that a little bit. At the beginning, people were doing some testing without necessarily getting that prior approval or having a limited one. So we really want to make sure that when we're relying on those tests for results, that it has some good validity.
So Mendocino County Sheriff has stated, when does the chemo become worse than the cancer? When referring to the current restrictions placed on the residents of the North Coast and its economic and mental health impacts. Can you share your thoughts on that statement?
Well, I guess I don't particularly want to comment on the sheriff's statement, but what I will say is that, ultimately with this, we're trying to balance loss of life against all of the consequences we know occur when we're placed in this restricted environment in terms of our social and economic activity. So it is difficult, certainly, it makes us cautious as we move forward so that we take all of the information that we have available to us and make the right choices.
Last week, North Coast News interviewed a couple who had been married for 56 years. The wife is hospitalized at St. Joe's with cancer, but due to CDC guidelines, her husband is not allowed to visit with her to protect hospital patients from the outside risk of COVID. May exceptions be made for visitors if they test negative first prior to entry, and who has the authority to make that decision?
Sure. So, I'm extremely sympathetic to this situation. I understand the difficulties. But we're right, going forward, we really need to make the hospital as safe a space for patients as possible. It's just incredibly important. And I think to the point about the testing negative, the problem we face with that is that, the point of care tests that can be run in a few minutes on site are not good for diagnosing COVID or picking up the virus in someone who does not have symptoms. So it really can't be used in that way as a screening tool for someone coming into a facility. And the tests that are different than that, like our test, just take a much longer time. If I test you today and you're negative, when you get your result tomorrow, it doesn't mean that tomorrow you are still negative. And so there's really just no way to be absolutely sure that someone coming into the facility does not have that virus in a way that you would allow necessarily people who are coming in for visitation to come in. And again, every hospital has to make that call, but we do recommend that people do follow those guidelines to protect everyone.
And then finally, do you think large outside/inside gatherings such as the Humboldt County Fair will be allowed by August 20th?
That is a tough question, and I really love county fairs. What I will tell you is that it's really just too soon for us to know. We've really just begun this move to ease restrictions. We clearly know that mass gatherings are going to be among the last things that we're able to have in place. And so whether that's something that will happen at the end of the summer or something that won't happen until the fall, I don't know. But I think we'll be learning a lot over the coming weeks, and it might make us better able to make those predictions.
Great. Anything else you'd like to include we didn't touch on today?
Can't imagine. No, thank you.
Okay. Thank you.